we've got a story that's really sobering,
Yep.
and it deals with healthcare opportunities in rural parts of our country.
Here in Banks County, Georgia, where I live, we're one of 23 counties in the state that doesn't have a hospital. Nationwide, rural hospitals are closing their doors. Doctors and nurses are pushed to the limits. And now another blow, insurance companies pulling back, leaving rural families with fewer and fewer options. One person who feels it most is Sharon Thomason.
It's just been a nightmare.
Sharon can't see her doctor of 25 years because he's now out of network. And to make matters worse, Sharon's husband has cancer.
How far do y'all have to drive for your husband's cancer care to Athens?
Hour. You hear people say all the time, you got to choose between medication or something to eat. We're there, and I never thought I'd be there.
It costs more to deliver health care in rural communities because of the smaller number of patients served relative to the fixed cost of services. In May of 2023, Sharon's family, along with thousands of others here in Georgia, including my own, received this letter in the mail from the Northeast Georgia Health System, telling us that our health insurance, United Healthcare, one of the largest insurance providers in the country, is no longer accepted at their hospitals or urgent care centers. Because United Healthcare and the Northeast Georgia Health System can't come to terms on a new contract.
We've had to change treatment plans, doctors, and everything in the last few months in the middle of treatment.
Describe this whole experience in one word.
Devastating.
According to the United States Census Bureau, 12% of rural residents under the age of 65 don't even have health insurance. In rural Georgia, I'm Chris Knight.
Yeah, you're dealing with a health crisis. The last thing you want to have to worry about, obviously, is changing insurance companies or whether you have insurance coverage. I mean, that's just a nightmare.
You know, out of all of the issues, I would say this is the one that gets me the most angry, the most riled up. When you need help, when it's life and death, just like you were saying, you shouldn't be having all of these changes, having to deal with insurance and navigate that. I just feel for these folks, especially in these rural communities. And you talk about a disenfranchised group. This is only adding to that.